Hello students, welcome to the new session of physiology, which is renal system, and one of the important chapters, the first chapter in the renal system, is body fluids. About 60% of the body weight is composed of fluid. That means if you take about a 70 kg person, in that case 42 liters that will be the fluid that will be contained. And this body fluid, the composition of it, the amount of it is very important parameter which should be monitored. The total body fluid is less in old age and is less in women because the percentage of the fat that will be more compared to that of the body fluid. Now, how our body fluid is being maintained? For that you have to remember a simple rule. What is that rule? The intake will be equal to output. That means whatever the loss of the fluid is there, that means the output is there, that should be balanced by the intake. Now, what are the sources of intake? The sources of intake varies from person to person. It varies from the day to day. It also varies from the climatic condition, the type of the work the person is doing. How we ingest the fluid? We ingest the fluid in the fluid form as such, and we ingest lot of fluid along with the food also. At the same time, the one also should know that a lot of fluid is also being synthesized in the body through metabolism, especially the metabolism of the carbohydrate. So, if we take an average value, the fluid ingested is about 2100 ml per day, and whatever the fluid we get it from the metabolism, that is equal to 200 ml per day. The total overall consumption or the intake of the fluid, that will be equal to 2300 ml per day. Now, what are the sources of loss of fluid or the output? First and foremost important is the insensible water loss. Now, what is this insensible water loss? As the name suggests, insensible means what? We are not aware of it. Now, you might be aware that there is a continuous loss of the fluid or evaporation of the fluid from the skin. Remember, this is quite different than that from the sweating. The loss of the fluid from the skin, that comes into the insensible water loss. Also, similar evaporation of the fluid also takes from your respiratory passage. Now, the important thing you can remember is that keratinization of the skin, that means the keratin layer, which will prevent this evaporation. That is one of the important protective mechanism. And in case of burns, this keratinization is lost. So, in case of burns, there will be lot of amount of the fluid that will be lost to the insensible water loss mechanism. So, if a patient is admitted in the ward with the history of burns, you should take this into consideration that there is an amount of insensible water loss has tremendously increased. So that the input, that is the IV fluid, what we will be giving, that should be corrected according to it. Why there should be loss of fluid through the respiratory passage? The air which you inhale, it has to be vaporized. It has to be moisturized. So that the water vapor pressure, that will be equal to 47 mm of Hg when it reaches to the alveoli. And for this moisturization also, there should be continuous loss of fluid or fluid is being evaporated from the respiratory passage. You might be knowing that in a season of cold, you feel dryness in the mouth or dryness in your throat. Why that feeling of dryness? Because the cold air has got very less amount of the water vapor. When the air goes through the nose and through the respiratory passage, lot of amount of the water vapor has to be added to that. So therefore, that's why you feel the feeling of that dryness is there whenever the air is being ingested. So these two losses, which is either through the respiratory passage and through the skin, that comes under the insensible water loss. What are the other sources of the water loss? Sweating. Yes. This is a very important thing to regularize your body temperature. At the same time, if you are in a very hot, humid climate, lot of fluid is lost to the sweating. So, on an average, if you take 1 to 2 liter per day, that is per hour, that can be lost, but it can severely increase in case of very hot climate or if you are doing very heavy physical exercise. Some fluid is lost also to the feces. Now, normally the amount that is lost is just 100 ml per day, but the fluid which is lost in person with a diarrhea, that is much more through the feces. So this should also be taken into consideration. And the last but the most important fluid loss mechanism is through urine. Now, what is the importance of this mechanism? This is the only mechanism which the body can regulate If you understand the capacity of the kidney can excrete from 0.5 liters to it can even excrete to 20 liters per day. How the kidneys monitor this loss? The kidneys try to maintain your fluid balance, the amount of the fluid in the body. So it tries to maintain the intake is equal to output. And the output that is being maintained is to the amount of water that is lost to the urine. Not only the kidneys maintain the body fluid, amount of body fluid, even the kidneys can regulate the electrolytes to the urine that is being lost. So the loss of fluid to the urine is important in a sense that it can be monitored by the kidneys and thus by the body. Now, what are the divisions of the total body water? Total body water can be divided into extracellular fluid and intracellular fluid. What do you mean by extracellular fluid? The fluid which is present outside the cells. What is intracellular fluid? The fluid which is present inside the cell. Extracellular fluid can be again divided into interstitial fluid, that means fluid which is present in between the cells, in the tissue spaces, and plasma. So what is plasma? Plasma is the fluid which is present inside the vessel, apart from the cellular component of the blood. That is, plasma is equal to blood minus the cellular components. How much is the amount of the plasma? Generally the plasma is equal to 3 liters, whereas the interstitial fluid is equal to 11 liters. Now, one important component of the extracellular fluid, or one important part, is the transcellular fluid. Now, what is transcellular fluid? This is the fluid which is present in the special compartment, such as cerebrospinal fluid. It includes the synovial fluid, that is the fluid present in between the joints. It includes the pericardial fluid. It includes the pleural fluid. So this is called as transcellular fluid. In most of the physiologists, they consider it as a special part of the extracellular fluid. But one has to remember that the composition of the transcellular fluid can be very well different than that from the extracellular fluid. What is intracellular fluid then? The fluid which is present inside the cell. Now, when it comes to the composition of this different body fluid, the composition is quite different. Though there is a continuous exchange of the electrolytes and the fluid in between the compartment and to outside the body cell, but the composition of it, that will be significantly different. When it comes between the extracellular fluid and that between the plasma and the interstitial fluid, you know that there is a continuous exchange of the body fluids through the capillary. So therefore, the composition of the plasma and the interstitial fluid, they are almost similar. Only the difference will be slight. It is because of the dominance effect created by the plasma proteins. Now, plasma proteins, they are mainly the albumin, globulin and fibrinogen. Plasma protein will have the negative charge. And what will be the dominance effect then? According to the dominance effect, the presence of an undiffusible ion across a membrane will affect the presence of the diffusible ions. So this negative charge will try to hold more of the positive charge or cations. So therefore, some more amount of cations that will be present in the plasma as compared to that of the interstitial fluid. But when it comes to the composition between the extracellular fluid and the intracellular fluid, that will be significantly different. As you can see in this table, the extracellular fluid contains lot of amount of sodium. It contains mainly the calcium, chloride, and it will have bicarbonates. Look at the difference between the composition of the sodium between the plasma and the intracellular fluid. Whereas same, the calcium is almost absent in the intracellular fluid. Sodium is always coupled with the chloride. So the chloride concentration is also the more in the plasma and the bicarbonate. When it comes to the intracellular fluid, the concentration of the potassium, the concentration of the magnesium, then it has got the more concentration of the phosphates and sulfates and proteins. Proteins which are normally synthesized by inside the cell, so therefore the concentration of the protein is virtually more. And when you look at the osmolarity of the extracellular fluid and the intracellular fluid, the osmolarity will be almost maintained similar, but there will be slight difference. 282 milliosmoles per liter for the plasma or the extracellular fluid, whereas 281 milliosmoles per liter for the intracellular fluid. The osmolarity will be maintained constant is mainly because of the movement of the water across the membrane, cell membrane. That will be able to see that. The next question in front of the physiologist is to how to calculate or how to measure the amount of the body fluid compartment. The method he uses indicator dilution, dye dilution method. Now what is the principle of this method? I will draw the figure so that you can understand it better. Now, suppose if I take a syringe and in the syringe there is suppose there is a volume of the fluid. We will call it as Vs. It has got certain dye or chemical which is concentrated here. And I insert this in a compartment of which the volume I do not know. Let us say it has got the volume Vp. Now, once I insert this concentrated solution, what will happen to that substance whose concentration, let's say it will be equal to Cs. So that substance will get diluted in this compartment. And now after it gets totally diluted, it gets soluble, then I measure the concentration of that substance. Let us say the concentration of that substance will be Cp. So one has to remember the principle that the amount of substance will remain same, the amount of dye. So what will be the principle? Vs into Cs, that will be equal to the amount of that substance, will be equal to Cp into Vp. Now what we have to know? We have to know how much is the Vp or volume of that fluid. So if I do the simple calculation, Vs into Cs upon Cp, that will be equal to Vp. This is called as indicator dilution method. Now, what are the substances or which are the substances I can use to measure the different body fluid compartments? What should be the criteria for it? Number one, that substance should be non-toxic. Then number two, that substance should remain in that body fluid compartment which I have to measure. That substance should not be excreted easily. If at all it is excreted, I should know the rate of its excretion and it should be easily measurable. So using this criteria, what are the substances we can use? As you can see in this slide, for total body water, the most commonly substances they are used is heavy water or radioactive water. Whereas to calculate extracellular fluid, the substance which I can use is inoline or thiosulfate. Whereas to measure the plasma, that is volume, Evans blue dye or the radioactive albumin, these are the substances which are commonly used based on the criteria on which we can measure. Now next we will see what are the effects of adding isotonic, hypertonic and hypotonic solution to the extracellular fluid body compartment. First, let us revise what do you mean by isotonic fluid? One which has got the osmolarity similar to that of the plasma, that is our body fluid compartment. What is hypertonic? One which has got the osmotic pressure or the osmolarity more than that of the body fluids. And what is hypotonic solution? One which has got the osmotic pressure less than that of our normal body fluid. Now, if you want to revise, what will happen to the RBC if it is kept in a isotonic, hypertonic or hypotonic solution? Let's see. Now, these are the three situations in which we keep our RBC. This is the isotonic solution, this is the hypertonic solution, and this is the hypotonic solution. In isotonic solution, there will be no movement of the water as such because there will be no endosmosis or exosmosis. So therefore, the size of the RBC will remain same. But what will happen if the RBC is kept in a hypertonic solution? Naturally, the intracellular compartment here, that will become hypotonic. So the fluid will try to move out of the RBC. So what will happen to the size of RBC? RBC will shrink. The fluid will move inside here if it is kept in a hypotonic solution. So what will happen to the size of RBC? The RBC will swell. So this is the basic, if you remember this basic principle, then you can understand what will be the effect over the body fluid compartments. What will happen if the body fluid compartments change their volume? Now when this can happen, there are certain conditions in which the body fluid compartments can change, such as in case where there is a dehydration, severe dehydration, diarrhea, vomiting, excessive sweating. In these cases, not only the volume of the body fluid compartment will change, but also there will be change in the osmolarity. Now, imagine a situation if I add an isotonic solution. suppose a person is getting a normal saline to the IV fluids. So, can you guess what will happen to the extracellular fluid compartment and the intracellular fluid compartment? Now, I am giving an isotonic solution to the patient through the IV. So, naturally it will go to the plasma. That is mean the extracellular fluid compartment. Now, the fluid will not move from the extracellular to the intracellular fluid. So, ultimately what will happen? The extracellular fluid compartment will increase, but there will be no change in the intracellular fluid compartment volume. What will happen if I add a hypertonic solution to the extracellular fluid compartment or to the IV fluids? In that case, the osmolarity of the extracellular fluid compartment will increase, and the water from the intracellular fluid compartment will move outside. So what will happen? The extracellular fluid volume will increase, the intracellular fluid compartment volume will decrease, and the osmolarity of both the compartments is going to increase. Imagine a situation if I add a hypotonic solution to the extracellular fluid compartment, that is to the IV fluids. In this case, what will be the change? Now, if a hypotonic solution is there in the extracellular fluid compartment, naturally this fluid will try to move from the extracellular fluid compartment into the intracellular fluid compartment. So the volume of the intracellular fluid compartment will also increase, the extracellular fluid compartment will also increase, whereas the osmolarity of both the compartments will decrease. Now we will see certain situations where there is a electrolyte disturbances. The electrolyte disturbances most commonly can occur, which is clinically most important, is the sodium concentration. And the condition we call it as a hyponatremia or hypernatremia. The sodium concentration, if it is measured, it will also reflect the osmolarity, because that is the main electrolyte which is going to determine the osmolarity of the solution. We say when there is a hyponatremia, the normal sodium concentration is 142 milliequivalent per liter. So in case of hyponatremia, the sodium concentration will decrease below 142 milliequivalent per liter. Whereas in hypernatremia, the sodium will increase more than 142 milliequivalent per liter. Now, we'll see the number one situation, that is hyponatremia, which is much more common. What can be the causes of hyponatremia? Hyponatremia is what? The sodium concentration in the extracellular, that is the fluid, it has decreased. So this can happen in two cases. If there is a loss of NaCl more than that of water, in that case, we will call it as a hyponatremia dehydration. That means the water loss is also there, but the loss of sodium chloride is more than that of the water. Whereas, if at all the excess just water is added to the extracellular fluid compartment, then also the sodium chloride solution, that is concentration, will decrease. So in that case, we will call it as hyponatremia overhydration. So the hyponatremia, the causes can be divided into hyponatremia dehydration, where there is a loss of NaCl more than that of water, and we will call it as hyponatremia overhydration, where there is excess of water. Now, what are the examples in which I can have hyponatremia dehydration? In case of diarrhea, where there is a both loss of fluid as well as loss of sodium chloride, but the electrolyte loss is much more than compared to that of the fluid. If the person is administered excess of diuretics, in this case also the loss of electrolytes which will be more than that of the fluids. In case of Addison's disease, where there is aldosterone deficiency. So aldosterone deficiency, what is the function of aldosterone? To conserve sodium and chloride, that is electrolytes. So if there is aldosterone deficiency, excess of loss of sodium chloride, that will be there, and ultimately it will cause hyponatremia dehydration. Because along with sodium chloride, kidneys will also excrete some of the water. But the electrolyte that will be excreted, that will be more compared to that of the water loss. What are the cases, examples where I see hyponatremia overhydration? Syndrome of inappropriate secretion of ADH. In that case, there is excess of ADH is there. Or the bronchogenic tumors, which will secrete ADH. So excess of ADH will try to conserve more and more of the water. But because of that, the water concentration or the water level in the extracellular fluid, that will increase, and the electrolyte concentration, that will decrease. So ultimately the person will have hyponatremia overhydration in these cases. What is the effect of hyponatremia in the body? Hyponatremia is much more common clinical condition, and one has to remember that if the osmolarity of the extracellular fluid is decreased because of the electrolytes are there less, naturally there will be endosmosis. Endosmosis which will be much more critical in case of neurons. The fluid will move from the outside, it will go into the neurons will swell. And remember, the cranium is a closed cavity. So the excessive swellings of the neurons will cause certain symptoms. The person will have headache, nausea, lethargy, disorientation. And in some of the severe cases, it can be even cause herniation of the brain through the spinal cord, that is through the opening. In severe cases, the person can get even seizures, coma, or permanent brain damage, and death can even occur. But whenever the change in the osmolarity is slowly, that the change in the osmolarity occurs slowly, the body tries to adapt to that. How? Especially, the body will try to excrete or throw out some of the electrolytes such as sodium, chloride, potassium, glutamate, and the neurons will try to compensate for the decrease in the osmolarity of the extracellular fluid. But what is the risk in this patient? If the osmolarity is being corrected rapidly in this patient, now the neurons will not be able to accumulate those of the, that is electrolytes, too fast. And then it can cause rapid correction of the osmolarity in this patient, can cause a damage to the myelination. So in case of chronic hyponatremia, the correction should be very less, that is accordingly it should be monitored, that is 10 to 12 millimoles liters per day. Hyponatremia, which is a situation which is much more less commonly occurring, but it can occur in some of the cases. The hyponatremia can also occur in two cases, where there is excessive loss of the fluid compared to that of the electrolytes. So in that case, we will call it as hyponatremia dehydration. This can occur in central or nephrogenic diabetes insipidus. What happens in these cases? There will be a loss of fluid, that means excessive loss of fluid. But the electrolytes that will lost, that is not much similar to that of the fluids which is lost. In case of excessive sweatings also, when there is excessive sweating, the body will try to compensate. That is the fluid which will be lost, but the electrolytes that will be conserved. So in this case, there will be hyponatremia dehydration case. Whereas if there is excess of sodium, it can happen in case of aldosterone secreting tumors. So if there is excess of sodium, in this case it will be called as a hypernatremia overhydration. In this case, what will happen? More an amount of the electrolytes that will be conserved. Hyponatremia, why it is much less common clinical condition? It is mainly because the hyponatremia will stimulate thirst. And when the person drinks water, the hyponatremia will get corrected. But hyponatremia can be critical in patients who are not having good access to the water, or who are the hypothalamic thirst centers, they are being damaged, or in the comatose person, or the infants who are not able to have the ready access to the water. So in this case, this hyponatremia can be a serious condition. So with this we come to the end of this lecture, that is the body fluids. Next we will see about the edema.